Hi everyone, thank you for joining tonight's webinar. My name is Jasmina Alajic and I'm an accounts manager here at Erchonia XLR8. Tonight's webinar will be hosted by Simone Paul, the founder of the Footlift London Clinic and the Footlift Medical Pedicure. Simone is a podiatrist who uses our Lunula Laser in her practice and is here to discuss how introducing a non-thermal laser transforms her podiatry practice. We will be happy to assist you further at the end of the webinar, which for your reference will be recorded and sent out to all the attendees. I would like to alert you to the question and answer box on the right-hand side of the screen, which you can use to type your question as we go to Simone. We will be addressing these questions at the end, but please type them in as we go along. I will now allow Simone to start the webinar. So over to you, Simone.
Thank you so much, Justina. Hi, everybody. My name is Simone, and I'm going to be speaking about the Lunula Laser and the XLR8 because I have both in my clinic. So I'm going to begin the presentation. My camera will go off and we'll just start. Okay, so yeah, I mean, how the use of non-thermal laser transformed my podiatry practice and helped me see the light. So this is my clinical experience of utilizing Erchonia's Lunula Laser and the XLR8 handheld. So just to give you a bit more about my background, so I'm Simone Sandra Paul. I'm a HCPC registered podiatrist, and I've actually set up a couple of clinics in the Middle East. I lived in Dubai, Qatar, and Kuwait for several years, and I moved back about 3 years ago, used all of my experience over there to establish and form like my own treatments. So I developed the Footlift clinic. We started off with a couple of patients in 2019. We're now pretty much fully booked every single day. So we've got 2 locations in Soho, London. I've managed to formulate some of my own skin and nail products, mainly for the health of the nail and for the health of the feet and the skin. And I'm also working at the Whittington Hospital as a high-risk podiatrist. So we deal with things like ulcerations. We have a lot of different presentations that we give to NHS England. We advise them on foot care. So I really like the fact that I'm able to work privately and in the NHS. And finally, I am the partner of a vitamin company and supplement company called Zuki. So if you need any information about any of the things that I'm involved in, then you're more than welcome to tell me and ask me at the end. So we'll just get straight into it. So some of the learning outcomes. So I'm going to be discussing how I use the Lunula, cold laser and the XLR8 to prevent and treat onychomycosis, treat common foot complaints such as heel pain, foot pain, prevent foot and nail surgery, increase client satisfaction, improve foot function. And then my client, colleague and friend that I work very closely with, she's a really successful nutritionist in London. She's actually had Lunula treatments, so she will be speaking about her experience, and she'll be talking about gut health. So some advice and some tips that you can give to the patient whilst they're on the laser package. So hopefully you'll find that really helpful. She'll be joining us in about 20 minutes. Okay, so onychomycosis. So we know that it's a very common foot complaint. It's something that, especially my private colleagues, we get a lot of patients coming in. They're desperate. They're not liking the way that their feet look. And there are different stages of fungal contamination affecting the toenails. In order to diagnose and to form my treatment plan, I always use the Onychomycosis Severity Index. So it just classifies the extent and the damage of the toenail from 0 to 4. So 0 would probably be this top one here. So it's basically onycholytic. Loads of patients present with that if they've been doing lots of running. It's a bit of an air pocket in the nail, just allowing water to get in, but we can see the discoloration and the presence of fungus there. So I would always do clippings just to find out if there's candida or if there's Trichophyton rubrum. It's usually one or the other, or sometimes both. And then just as we go down here, we've got more advanced kind of onychomycosis according to the scale. So this would be about a 3 or a 4. So in the UK, just some facts, it does affect about 10% of the general population, 20% of the population aged over 60, up to 50% of people aged over 70, and 1/3 of diabetic individuals have onychomycosis affecting the toenails. But I also think that is associated with tinea pedis as well, because usually when a patient presents with onychomycosis, they either have developed tinea pedis or they started off with tinea pedis. Okay, so just go to my next slide. So what causes it? So there are internal and external factors that cause onychomycosis to develop. So internal examples that could lead to the development of onychomycosis would include gut and stomach conditions. I want to say mental health problems because, and I use that as an internal reason as to why somebody could develop onychomycosis. And that's because sometimes with mental health cases, patients can neglect themselves. We've had patients in the NHS where they don't really want to see their toenails, so they cut them off. We have mental health conditions that can sometimes lead to homelessness. So it becomes a bit of an environmental thing where they're not removing the shoes. But another internal reason why onychomycosis could be more prevalent would be peripheral vascular disease, just that circulation being reduced to feed the nail matrix and feed the nail plates just means that they get more brittle, they get weaker, and definitely systemic conditions such as diabetes. So it's all that sugar floating around. Fungal elements really like sugar, so they can multiply and develop further. So some external examples that could lead to onychomycosis would be bad foot and general hygiene. Sometimes this is unavoidable. We do lots of sports. We change in changing rooms where we can pick things up. But direct trauma to the nail plates, environmental factors such as working and living in damp environments. We have a lot of patients that come in, they work on boats, they're swimming teachers, so they're always in the water. But also non-breathable footwear, ill-fitting footwear as well. So if you're wearing shoes constantly with very narrow toe box, like a lot of our clients in London do, eventually it just traumatizes the nail plate so much that it's just lifting. So it starts off as that very first image that I showed you, just the lifting of the toenail, and then it develops into a fungal infection, especially if they continue to wear those shoes that don't have any space. But I mean, all said and done, I think we can agree that all named pathogens, they do thrive in warm, enclosed, damp environments. So footwear is the perfect environment for them to multiply. Okay. So the pathogens and species that are cultured usually are Trichophyton rubrum, but there are different types. There are dermatophytes and non-dermatophytes. So Candida is also one of the yeast fungal pathogens that can affect the toenail. But usually when I have sent nail clippings off, and they all come back with Trichophyton rubrum. In some cases, they've actually, well, in my experience anyway, they've come back negative, saying that there is no fungal culture. But if I can see that that nail is thick, it's yellow, it's crumbly, it's smelly, I'm still going to proceed with treatment. So the effect on the client, the reason I'm so grateful for the Lunula is because onychomycosis, like before I had the Lunula, it would be quite a frustrating condition to treat. So lots of topical applications that we'd recommend to the client just didn't work. We have a GP that we work with, and I would ask him to prescribe oral antifungals such as Sporanox, and that can actually make the patient feel really, really ill. We've had a couple of cases where clients just couldn't tolerate it. And when they do finish the course, there's no guarantee that there will be that the nail will be healed or the nail will not come back. So there's really no guarantee with that. So clients come in very embarrassed. They come in frustrated because often they've spent lots of money on over-the-counter stuff. And they're afraid and scared and apprehensive about spreading to other toenails. And it creates a lot of anxiety and frustration for the patient, because usually the nails that I see have been present for over 2 years, and they just get worse and worse. So they attend podiatry as a last resort, but they attend podiatry in my clinic specifically because they want a solution. So we're just going to talk about the Lunula Laser, the Footlift, so that's the treatment that I do, and nail hygiene actually. So it's not just about foot hygiene, it's about nail hygiene. So we pride ourselves on our treatments, and the cleansing and hydrating nail drops are a product that we've developed in order to treat, cleanse and hydrate the toenail, especially while they're having laser, and it works brilliantly. So as you can see, these are the results that we expect from our treatments. We have very, very high standards. We want that nail to look great after treatment. And the reason why we're able to make them look so great is because not only do I use the Lunula on nails that are fungal, but I advertise and I encourage patients to use the Lunula and go in for the 12 minutes as a nail cleanser. So we all have bacteria, we all have things lurking around in our shoes, and I encourage patients to come in and just get their nails cleaned with the laser, and it works perfectly with the treatments. And when the feet look like that, clients are more encouraged to look after them. So just about nail hygiene. Nail hygiene for our clinic basically means drying the toenails properly after a bath or shower. So most of the time we encourage patients to dry the feet properly in order to prevent, tinea pedis, athlete's foot. But that client is using that towel, that wet towel, all over the feet, goes right down to the feet. It's already damp. If they already have a fungal infection, then they're never drying their feet, basically. So we encourage, use a separate towel completely, really squeeze all of the water out, and that will really give you the best results, particularly if they're on a laser package. So in my experience, the Lunula Laser has actually proven to be safe and effective for the treatment of tinea pedis and very itchy feet as well. So I've been very, very happy with the results that I've been getting from that. Yeah, there's a picture of the Lunula there. Okay, so what I'm going to do now is I am going to speak about some of the cases that I have in clinic. Most of them I'm still working with, but some of them don't really need to come in for laser anymore because they've finished their course. They just come in for treatments. So the first case that I want to speak to you about is a poorly controlled type 2 diabetic. His HbA1c was very, very high. He had tinea pedis. He had a bit of bullous pemphigoid as well, so the feet were just so sweaty. He naturally had a hyperhidrotic foot type. and skin type. But the reason why I like to talk about this case is because he was an obese patient. He's 24 years of age. And this particular nail, I'll just hover my mouse over the area. Not only was it fungal, but actually he would subungally ulcerate. And as a result of the pain that he would be getting, he wasn't able to walk, exercise. So it's a bit of a vicious cycle. He would sit at home with the foot elevated because it got so sore. So yeah, fungal toenails, and especially if you're diabetic and you have neuropathy, peripheral neuropathy starting, it gets very sore. So we would consistently be dressing this subungual ulcer. This is prior to me having the laser. And of course it would just build up, it would weep on cutting, and it had been like that for 5 years. So we gave him monthly diabetic footlift, so we would clean the toenails very well. We would give him all of the advice, but we gave him, I changed the protocol very slightly, just purely because he was a diabetic patient and he just recently recovered from the subungual ulcer. We gave him 6 Lunula treatments 10 days apart, and topical applications of the cleansing and hydrating nail drops once the wound under the nail had healed. And he applied that to the affected toenail every 3 days. But you can see that 3 months after the Lunula laser course was completed, we were able to get really, really good results. Now, because of a patient of his size, I had to cut a lot of this away. But the really good thing is that he hasn't been getting the ulceration anymore. The nail looks much more healthy and he doesn't get any pain in that nail at all. And I'm happy to say, so I'm seeing this patient next week. I'm happy to say that he hasn't redeveloped the fungal nail, and that it's been almost, I would say 6 months that I haven't seen him. So we're really happy with the results, and so is he. And he's able to do his walking and his physio now. For the tinea pedis as well, that's under control. With him having such a hyperhidrotic foot, we do have to give him advice about the different socks to wear. But yeah, it's just not building up as much and it just looks a lot better and it feels a lot better for the patient, and that is thanks to the Lunula. So I've got another case that I'd like to share with you this evening. Okay, so this, again, it's a very interesting case, and one of the cases that I'm really happy with all of patients that we've been able to help. But this particular patient was stepped on by a horse. So she was wearing flip-flops. She was on holiday in Spain, and the horse stepped on her toe. And it was extremely painful at the time that it happened. Her nail came off, then it would grow back again, and it came off, and then it went, finally, when it did grow back, after the horse had stepped on her toe, about 12 months after, it would grow back, but it grew back onychomycosis. So as you can see, I mean, you've got lots of blood underneath here, so there's definitely damage to the nail matrix. The nail is completely distorted, and I did send this off just to get analysed, and we found that there was actually zoophilic bacteria, Trichophytum rubrum, and Candida. So that would definitely be a stage 4 according to the OSI, Onychomycosis scale index. She doesn't really have a complex medical history. She suffers from hay fever, but her job was the reason why she came into clinic, because this would get so sore for her. She's a hairdresser, so she has to stand on her feet a lot. She has to do a lot of pivoting and twisting, and she had also tried the antifungal medication, and nothing had changed. So this nail in particular was quite tricky for me to cut, because can't really see it here, but the nail bed and the nail plate were so close together, and there was so much fluid and wet kind of onychophysis underneath. It didn't smell too good either. but it was very, very, very sore for her. And also during the incident with the horse, the actual joint had become very painful. So she didn't get an x-ray, but I do suspect there was a slight stress fracture in the distal phalanx. So I got her in for a foot lift. We drilled everything down and we got her on Lunula straight away. So we also got her to take some collagen and some biotin, because the rest of her nails, even though this one was so thick, but they were all very brittle. So we also wanted to treat the pain that she was still getting in the joint. She had developed a bit of functional hallux limitus as well. So after the Lunula, I would get her toe and I would laser it with the XLR8. And that, because it's the medial plantar nerve that runs along here, that made a really big difference for her. So we gave her 4 Lunula sessions in total, topical applications of the nail drops. And of course, she was taking some Zuki, she was taking her vitamins. And as you can see on the right-hand side, that's 1 month after the Lunula Laser course has been completed. So very happy with the results. We were able to really get lots and lots of stuff, onychomycosis elements. There was hair trapped in there as well, so everything was just trapped. But you can even see just a bit of a reduction in the swelling. The skin is much better around here, just because it's not being starved of oxygen, because it does, when you have a thick nail like that, it just stops the flow of circulation, and it's fungal elements and tinea around here. So yeah, it looks much better. We can still see that there's a bit of an indentation there, but that's because the nail bed and the nail matrix has been slightly damaged. But I share this case because I could have brought her in for nail surgery and removed the nail, but she wanted to save her nail. And she was just really embarrassed about the appearance, the smell of it as well. And we've been able to really do an amazing job with the Lunula and with the treatments. And yeah, she's absolutely fine now and she doesn't feel uncomfortable. Just show you my next slide now. Okay, so this is a case, quite a recent case actually. So this particular patient, she would consistently put gel and acrylic on her toenails. And I believe that that is the reason that she developed fungal infection. So she'd been doing gel nails since I think since she was in her 40s. So if you imagine going to the nail salon, having gels put on under a lamp, but having acrylic tips put on that as well. Of course, the nail bed is just going to sweat, especially if you have a hyperhidrotic foot type. And then you do the same thing every 2 weeks. So you get that topped up, you get the colors changed over. And that had been present for over 20 years. She started to get she started to see me initially for ingrown toenail. And there's lots and lots of debris stuck down there, actually some old gel fragments. Because when you go and get gel done in certain places, they won't really clean the nail, they'll just put the product on, it's full of chemicals and it's just not good for the nail at all. So we brought her in for a foot lift, of course, so really cleans the nails. And we put her on the Gutbiome probiotic because she does have chronic constipation. So the medical history here was quite important. Because the gut and onychomycosis are very closely related, and that will be explained a bit more in depth by the nutritionist that's coming in. So I actually put this patient on 5 Lunula Laser, purely because after the 4 sessions, yes, it looked great, but I knew that this patient would be going abroad for quite some time, so she wouldn't be able to come in for her regular nail cutting and everything. So I gave her a top-up 2 months after she had completed the 4, and she's more comfortable with the nail. I forgot to mention actually that I did do nail surgery down the side of this nail to stop it from growing in so much. But this is a couple of months after the first Lunula course was completed. So, I mean, it was looking already much, much healthier. It's pink. It's not hurting her down this side anymore. And just in general, she's not really putting gels on anymore, just because she knows that the damage that this could do. So she stopped that. I'm not going to say to patients don't put toenail polish on, but if you are going to put polish on, it should be one of the healthier ones, such as Sundays. There's lots of different brands on the market. But yeah, it's looking much better, again thanks to the Lunula, and I wouldn't have achieved that result if I wasn't using that. So this is the product that I'm referring to, that really complements what we're doing with laser. You can see a couple of before and after pictures. So if you suspect that this is going to turn really heavily infected with the nail plate, I encourage the cleansing and hydrating nail drops, and I use it. I've been using it, and I formulated this product over 10 years ago. Not only does it hydrate the nail, so you've got the hydrating effects of the avocado, but you've got the astringent effect of spearmint and tea tree. And it's very clinical to use, because you just drop a little of the product. It's quite concentrated. You drop that on the toenail, and it does actually soothe the nail if it's a bit sore. So yeah, it encourages healthy nail growth. It actually works as almost like a glue. So without making the nail feel too wet, it just encourages the nail bed and the nail plate to sit back together. So yeah, it's been a brilliant product to introduce with the Lunula, because you just get great results. So they complement each other. Okay, just go to my next slide. Okay, so I just want to talk about tinea pedis, athlete's foot. And these are clients that I have worked with. Some of them have had fungal nails, some of them haven't. But I didn't realize how effective the Lunula would be for this condition. So you have mild, moderate, severe tinea pedis. We also get a lot of lichen planus in the NHS, but it has been amazing. So yes, of course, we're going to encourage patients to dry properly in between their toes. We're going to encourage maybe surgical spirit in between the toes. But there's so many products that I've recommended and used, and I have products for this in the clinic. None of them have been successful at completely treating the interdigital maceration like the Lunula has. So I've been really impressed, because this could start to lead to an onychomycotic nail, or the onychomycotic nail could form a nice environment and then transfer onto the skin. So yeah, it gets rid of all of those patches. The presence of the violet light obviously penetrates the skin, and the Trichophyton rubrum doesn't like that. So it also helps soft corns. So any maceration at all in those interdigital areas, yeah, I'd encourage you put the foot into the Lunula. Just get them to wiggle their toes a little bit, and the results are amazing. So I usually don't put them on a course because the results are so good. But after 1 or 2 sessions, you'll start to realize and see that actually the patient's tinea isn't as bad as what it used to be. Clients will also report less itching. And then the bottom right picture there, you can actually see that I've got the Lunula on. So during the summer, it's a very, very common foot complaint, and it can easily be treated with the Lunula. So it's great. Now, this is one of my regular patients. I've been seeing her for years. Unfortunately, she has itchy psoriasis, and she's got very sensitive skin, dermatitis history. So I have to be careful what I use. I can't really use Hydrex on her, so I would use either Prontosan or just water when I'm cleansing her feet. Now, it's been one of the cases that I have struggled with because this patient has come into my clinic with blood underneath her fingers because she's been scratching the feet so much. It gives her so much anxiety. I mean, I have a couple of family members, unfortunately, that have psoriasis. It doesn't affect their feet as badly as this, but this was so uncomfortable for the patient. So we bring her in for monthly foot lifts, and of course the appearance would improve. But we got her on some collagen, and in the end I referred this case to a dermatologist who, rightfully so at the time, put her on a steroid cream. But that made the skin very, very thin. We can see how thin the skin is already. We can see where she's been scratching the area. So I decided, do you know what? The Lunula can't really do any harm. It's low level, it's cold. I'm gonna stick her foot in there. Now, the way that I put her foot into the Lunula, I got her to lay down on the couch, got my extension cord, I got her to dorsiflex her foot, and in the foot went. So I did that after my treatment, after the foot lift. And this was a month after the first Lunula session. So, just to let you know, we gave her one Lunula session every 4 weeks. So I just wanted to see what it was doing. So brought her back in for the foot lift and for the Lunula. Now, I was amazed at the results because she emailed clinic saying, I haven't had any itchiness for a couple of weeks now. When she came in for her appointment, it was still there after the first Lunula, those kind of patchy, dry areas, which you'd expect. But as we continued to work with her, and she did put her foot in that Lunula for the 12 minutes, I was amazed at the results. I mean, you can see that she still has a little bit of sensitivity in the medial longitudinal arch, but it's successfully helped with the inflammation. As I said, the main concern, client wasn't really concerned about the dry skin, but she was concerned about the itchiness. So that was the most difficult thing. She doesn't get that anymore. So I will be monitoring her still, but she hasn't had the itchiness and she hasn't had the dry skin, thanks to the Lunula, so that's great. So discoid eczema. So discoid eczema, this patient has poor venous return and non-pitted oedema. She's 33 years old. So this reoccurring eczema patch, so every time the seasons would change, this is the medial malleolus, by the way, she would break down with this eczema patch. So I decided, after my success with the previous patient, I'm going to try in exactly the same way. And I got her in for 4 Lunula sessions, 14 days apart. Now, not only did this get infected when I first started to see this patient, but it cultured Trichophyton rubrum as well. And we tried everything. We've tried steroid creams, nothing had worked. So this is the recovery picture just at the above, and that's taken after the 3rd Lunula session. So it's the presence of the violet light, I think, that has helped this. Of course, we're giving her sterile bandages, but it's just been a fantastic tool. I haven't used the XLR8 on her, but I did get her in for Zuki, collagen, vitamin D. We had to give her some antibiotics as well. But just an example of what the Lunula can do. And I'm always testing and trying different things and seeing if it will help, just because there's no harm in trying. And also it can't really do any damage. Either the Lunula is going to do nothing, which it does a lot, or it's going to help. So the Accelerate, so improving chronic and acute foot pain one step at a time. So I've seen outstanding results using the Accelerate for the following conditions. One of the conditions that I find difficult to treat because it's such an avascular area, Achilles tendinopathy. So I've been able to treat Achilles tendinopathy in really tight calves with the Accelerate. Got severe hallux abductovalgus with bursitis, intermetatarsal bursitis, tibialis posterior dysfunction. Now, the Accelerate doesn't obviously fix the dysfunction. Orthotics will assist with that. But what I get patients to do is to try and just strengthen that tendon as much as we can, and the muscles, the intrinsic muscles around the foot. I get them to tiptoe whilst applying the Accelerate to them. And actually that prevents pain, but also it encourages circulation around the medial malleolus. And that just encourages the foot to be a bit stronger, prevents plantar fasciopathy and fasciitis. Tight calf muscles, plantar fasciitis, I've used the Accelerate on that as well. Stress fractures affecting the metatarsals, and neuropathy. So on a dermatome setting, neuropathy has been, well, I wouldn't say it's completely been eradicated from my clinic, but certainly after a couple of sessions of the Accelerate, patients complain less about nerve pain at the top of their foot. So I get a lot of ladies that are going through menopause, they're diabetic. So I encourage, if they're starting to get numbness in their feet, I encourage just try and wake those nerves up with the Accelerate, and they're open to trying it, and it works. So I've been really impressed with the results. This is me with Rob Sullivan. We're applying laser to a patient that has rheumatoid arthritis. The second picture is me applying the laser to a heel, and the third is me applying laser to a severe bunion. And yeah, this is me just using the laser basically. So getting the patient to really push into me as much as we can, releasing the tension in the calf. And this is just a video testimonial from one of my patients, which I'll play you a little bit later. So he's an interior designer, and unfortunately a brick fell on his foot and he was getting terrible pain in the first MTPJ. But what I'm going to do now is get my colleague Rebecca, who's going to speak about gut health, nutrition, sugar, and she's going to talk about her experience as one of my patients. So just give me a second. I'll just introduce you.
Okay. Just give me 2 minutes and I need to wrap up. Yeah, because I told you.
So guys, Rebecca is here. So as I said, she is my client. She's going to talk about her experience of using the Lunula. She can talk about gut health, nutrition, sugar, as I said, fungal infections. So without further ado, thanks for joining us, Rebecca. You can sit here.
Okay. Hi everybody, I'm Rebecca, and I'm going to be speaking to you tonight not only from a nutritional therapist point of view, but also as a patient of Simone's, because while I was studying nutritional therapy, which I've actually studied twice, once in New York and once here in London, because I developed an issue with a fungal infection on my toe, and I spent, I think it was 4 years going around in multiple circles, not really getting anywhere with it, with clearing it up, and then also studying at the same time. So while I was studying, I had access to gastroenterologists that most people wouldn't normally have access to, and I was able to dig into and study fungal infections for an extra 2 years because I got on with a few of my professors really well. And I was thinking tonight, how am I going to explain and keep you interested in fungal infections? And I think a really interesting fact is once a fungal infection starts, say, for example, on the toe or the foot area, it will then eventually travel and it will make another home, if you like. It will be either in the nostrils, the eardrums, the bladder, and the tubing to the bladder, and then also the skin and underneath the fingernails. So the longer it goes untreated, the longer it has to make a home. And one of my professors always used to explain a fungal infection as a bad guy, or you would hear in the media that it's called a pathogenic bacteria. And we also have beneficial bacteria. And so because while I was clearing up my own fungal infection, I went on extreme food plans that were written by professors and researchers, quite unpleasant ones, and I did them for really long periods of time and nothing changed. The fungal infection almost takes on like a personality of its own within us because it has demands, it needs to be fed, and it doesn't matter how long someone goes on a restrictive diet for, until there's a time where they have something that's not on the plan or something that they're not meant to have, however you want to say it. And the fungal infection takes off and has a whole new life again because it doesn't need light, it doesn't need oxygen, it just needs sugar and some of the byproducts that come from some of our foods. So some of our foods have high amounts of mold, they have high amounts of damp, and it's fine in small amounts. But when they take over, we change how we see ourselves because we see ourselves through our cravings. And I now have patients that change the view on who they are as an individual because a certain food has more, they feel has more control over them, their personality, and how they spend their time with friends and family, because the pathogenic bacteria, pathogenic fungus will always want to be fed. And when we introduce beneficial bacteria to then eat back the fungal infection, there also needs to be a complementing amount of fiber and protein and complex carbohydrates with healthy fats in certain ratios in order to get in front of the fungal infection starting to ask to be fed, which is another way of me saying creating cravings. And what's really fascinating when I put someone on a 6-week plan, the main feedback I get from the individual, whether it's male or female, is they'll have a moment where their fungus has dried up and died. So it could fall off from around the fingers, depending on if it's been underneath the fingernails. And it also could fall off from the inner nostril or the inner eardrum. And what I mean is a whole tube of extremely dried fungus, which would almost look like very fine old skin, falls out in a solid clump. And it's a moment to be celebrated because after that, the person is free, free of the fungal infection and free to feel like themselves again. And that is what sort of gives me the biggest joy and also makes up the for the horrible experience the person's normally been on in order to come to me, because I'm normally like the last stop, and it's also the most rewarding stop because I know I'm the person that's going to get them the most results. So yes, it's just incredible what we can do to support you, and the food still tastes good, and the meal plan still being something you actually want to engage with, that is fun and loving and empowering. So these are like very important factors, because anyone can go on a diet or a food plan, but not very many people receive the actual benefits and the rewards from what it actually means to fix and heal something like a fungal infection. And then the person starts seeing themselves as themselves again, and a new sense of vitality comes. So this is what I see in my own clinic a lot, and this is how I spend most of my days, helping people really come back to who they truly are, before they got their fungal infection. And one of the ways I do that is I advise that we get in front of the cravings before they start, especially through your food plan. And one of the biggest things I think I learned as well on my journey was the oils and the products that we use on top of our skin or on the feet, really, especially when they're well thought out, excellent quality ingredients, like the nail oil Simone has. What that does is, because within 26 seconds it's in the bloodstream, it's actually eating away the fungal infection before it gets to the main artery in that leg. And so once you've got your fiber going in, your proteins going in, and you're stopping the food source to the fungal infection, a rapid starvation effect then follows through. And then what I find is, then once people are using the lovely foot spray, which is actually one of my favorites, and protecting their skin and their toenails and their feet and keeping a clean rotated sock, then is when we see the marrying of the two treatments coming together to create the most positive effect. So yeah, so that's my experience mixed with my knowledge of training as a nutritional therapist. So I hope that was helpful, and I hope it was also understandable, because I think that for someone like me, I could talk for 2 hours or 3 hours about the importance of all of these factors I've just touched on today. So I wish you all the best with your journey, and don't give up. Don't let the fungus win.
Thank you so much. Great. Any questions? Okay, guys, so I hope that gives you a bit more understanding about how you can recommend certain foods, and the importance of fiber, and how that can really improve the results when they're on the Lunula course. So I hope that's been helpful. I'm just going to summarize everything now. So in summary, I would suggest that the best results for treating onychomycosis successfully and to prevent reoccurrence, that will be achieved and maintained through thorough foot treatments, looking at the client's lifestyle, looking at their food, like Rebecca mentioned, food and cravings, find out what they're eating, tell them not to eat as much sugar whilst they're on this course if they want it to work. Internal and external factors, make sure the patient understands exactly why they have toenail fungus, And I just think treating all clients equally and incorporating the Lunula Laser into their treatment plan to avoid oral antifungals. And we want to obviously ultimately prevent cross-contamination. So gut cleanses, probiotics, but you should definitely consult nutritionists before you start recommending gut cleanses if the fungal infection is still present. But these are all of my patients. Some of them have had XLR8 laser, some of them have had Lunula. You can see that I've got it on whilst they are having their treatment. The results have been fantastic, and I really feel that it's a very, very positive treatment modality to put into your treatment plans for treating onychomycosis, for treating tinea pedis, and just encouraging really good foot health. I've been really amazed with the results. And I just wanted to show you my lovely patient on the bottom left. She's 101 years old. She's had about 4 sessions of laser with me for a yeast infection that was present in the toenails. It cultured as candida. She's 101 years old, and she's been able to get rid of that. We've also put her on a food plan as well. And we've also put her on a course of XLR8 for some heel pain. So yeah, if you combine everything with a great treatment plan, following the protocols of Lunula, you get really fantastic results. So yeah, I mean, if anybody has any questions, then I'd be more than happy to attempt to answer them. Rebecca is still here if you have any food questions about what you may want to advise patients. But this is our information. info@footlift.co.uk. You can follow us on Instagram. You can visit our website as well. But thank you so much for listening to this presentation. I'm just going to turn the camera on now. Hi, Justina.
Thank you very much, Simone. It was really educational. I hope everybody, all the attendees had found this webinar very educational, very helpful. For now, we don't have any questions at the moment, but I would still like to address to everybody. If you have any further questions, please do contact us. Let us know whatever questions you have that we may be able to help you with. Yeah. And just a quick note, I had a question, probably that's for myself, from Jonathan Kirk. Will this be recorded? Yes, it will be recorded, and it will be sent out to all the attendees and all the registrants after the end of this webinar. And thank you again, Simone, for hosting the webinar. And have a great evening, and thank you for tuning in, everybody. Thank you.
Justina, thank you so much, and come and see us soon, okay?
I will.
You've got my email anyway.
I will. It will be my pleasure to meet you in person, Simone.
Absolutely.
Thank you so
I look forward to that. All right. Take care.
All right.
Thank you so
Bye-bye.
much.
Have a lovely evening. Bye.
Bye. Bye. Bye. Let's make sure my camera's off. Take that away. Yes, I want to leave.